Love flicks one to Rubio. Rubio to the foul line. And a foul is called. It's on Graham and Ricky. Ricky was grabbing to his left knee in that.
You fell on the Bonita. You fell on.
Ouch. What happened to Mr. Rubio was an ACL tear, but what exactly is an ACL tear? An ACL tear is the tearing of your anterior cruciate ligament. Your anterior cruciate ligament works with three others in your knee to hold together the femur and tibia, also known as your thigh and shin bone. Its main purpose is to prevent the shin from sliding too far forward in front of the femur, which is why it's so essential for the stability of your knee. The ACL can get either partially torn or fully torn depending on the severity of the injury. ACLs are most commonly injured by the sudden change in direction while moving, direct collision with the knee, suddenly stopping while running, or awkwardly landing from jumping. These injuries almost always come from playing sports, such as football or soccer. However, these injuries can happen even more often if you're not wearing the proper footwear, playing on turf, or if you're not properly conditioned. You'll know if your ACL is torn if you feel immediate pain, swelling, or hear a popping noise in your knee. To Mr. Lee for more.
Thanks, Ryan. Ouch. That was a nasty injury. Ricky Rubio had an unsteady landing on the ground due to slipping on his right leg. Ryan mentioned the many ways one can have an ACL tear, and in this case, it was the awkward landing on his foot. Now let's apply that to Rubio. How bad do you really have to slip to have an ACL tear?
After slipping, Ricky put all his pressure onto his left knee. This means a whopping 190 pounds, all for a leg that is in an awkward and dangerous position to hold up. As we can see, his knee doesn't do so well either, and awkwardly pivots, trying to keep itself intact as Rubio is falling. It takes around 500 pounds of pressure to tear an ACL, but when falling and having a bone as a pivot point, it's much easier to snap. Additionally, gravity makes his 190 pounds much heavier and harder to hold up, and it is not surprising that Rubio tore his ACL in this situation. Let's look at what's going inside the leg. As we can see, the top of the leg twists as the bottom part stays planted in the ground. This causes the ACL to tear. Additionally, Rubio falls, causing more pressure on the ACL and snapping it.
For treating a torn ACL, there are many options. Right after the injury has occurred, do not try to move your knee around and rest immediately. Try to apply first aid procedures as well and go straight to professional treatment. If the ACL is partially torn, follow standard at-home rehabilitation. MICE, RICE, or any other procedures approved by medical professionals. However, if the ACL was fully torn, surgery and external support items like braces may be needed to recover fully. When in doubt, contact a medical professional for reassurance and guidance because treatment will vary differently on injury severity.
We're here with trainer Megan and I'm about to interview her. So where do you usually find ACL tears the most?
ACL tears could happen in any sport. I'd say the most commonly affected athletes are usually women's soccer players or women's basketball players.
Alright. If someone had an ACL tear, what's the first thing that they should do?
The first thing they should do is get medical treatment. So talk to someone, an athletic trainer, orthopedic doctor. We want to make sure that that's what it is before you do anything else. They're going to let you know, the orthopedic doctor will let you know if you need surgery. They'll do an MRI to check out those ligaments. A big thing when you tear your ACL is you want to make sure that you keep your range of motion. So a lot of times with an ACL, it's very uncomfortable to have your leg fully extended, but it's really important that you keep that extension and you keep the flexion in your knee, because it can get really stiff, and if we don't want that, because that's going to make it take longer to heal.
So what could someone do at home to recover from an ACL tear?
At home, there's a number of exercises that you can do. Just to, like I said, keep that range of motion. There's exercises to keep the strength. Right after an injury or right after surgery, you can ice it. You want to keep compression on it. You want to try to avoid walking on it because that could make things worse. The main thing is going to the doctor, getting the doctor's orders as to what to do at home, and then following up with physical therapy. They're going to give you a home exercise program that you want to follow at home to help you get better.
Thank you. That's all.
Okay.
Have a good one.